Well, on Tuesday, March the 10th at noon, Mayor David Holt and I, along with senior leadership at the Oklahoma State Department of Health and the Oklahoma County Health Department, will roll out our 14-year initiative to move Oklahoma City from one of the least healthy cities in the country to one of the healthiest. So, Matt, as someone who spent your career studying what actually moves the needle on human health at scale, what would you tell a city that's about to take on that kind of challenge?
Well, first of all, I would say it's possible. Don't get bogged down in the idea that this is an unsolvable problem. It's a solvable problem. I think engaging with voices of who are thoughtful and credible in the space is going to be super important as you really try to think about how do you implement programs that are actually going to be successful at the population level. But it is doable. And then at the individual level, I would go back to what I said before, which is to recognize that your health is your greatest asset. And so start thinking about, have you been investing in your health? Should you be investing in your health? Obviously, I think the answer is yes. And then what does that mean? What do you actually do to invest in your health? I think that's the start of the journey. And then you can start to become informed and identify for you personally, what are the biggest steps that you can take to get yourself onto the best health span trajectory that you can be on. And you can do it. I did it. I know it's not too late. So I hope some of the people listening, if you haven't already started, that this will be an inspiration to you to start that process and put yourself 10 years from now, 5 years from now, in a better health trajectory than you're on today.